Okay, thank you very much. It's my great pleasure to be here and to share some views with our colleagues. And don't be surprised if some of the slides I myself could not understand, because I'm a bench scientist, so talk about this topic is never happened to me. So it is itself a learning process for me. I would like to go through it's not so long, the new China, about 50 years history from the past to present, and give some perspective for the future. In the broader sense for infectious disease control, but I would also use, since I'm working with AIDS for almost 16 years, so use AIDS as one example to address the partnership. The health policy in China is prevention first. This is because we have a huge population, so we know everything prevention is much cost-effective than treatment. So this policy has been, to some extent, went through very well and has been in the first half of this country until the open door policy. This is also in a planned economy, which everything is supported by government and no private sector at all, or also no non-government. There's a lot of non-government organizations, communities, but they are also supported by government. So they do everything from research, product development, and even everybody's family affairs. If there's a fighting in the family, the director of the institute has to involve and have to persuade that they don't get divorce, stay together. Everything like that, including their kindergarten, school, and everything is programmed from the very beginning. And also, in this field, is the same. So there are 7 institutes are set up by the government. Because of China is big, transportation costs a lot. So they divided them into 7 areas. To each of them stay taking care of, in the center of this area, taking care of the whole area, divide the country. And in a way, to delivering vaccine is very cost effective, actually. For the historical reasons, China has been isolated for almost 30 years. First by the Western powers, then later by Eastern blocs. So we have to do everything from inside to develop. This is a vaccine developed in the first 30 years, which has been produced. Still, China is the largest vaccine producing country. So every vaccine we have to do from scratch and to develop, go through. I would like to point to one vaccine, which is vaccinia vaccine. Recently, our NIH colleagues, they are quite surprised knowing that China has 30 years ago already developed a tissue culture vaccinia vaccine. We heard also in Europe, Pasteur Institute donate about 40 million doses of vaccinia vaccine to U.S. government. This is both U.S. product and European product are, the animal lymph nodes and, just very old version of vaccine. But China, we have been using that for many, many years. There's one example which is really a partnership between all sectors of society. So the STD is one, and also the social development parameter like life expectancy has been doubled in just a little bit over 40 years. This is done through a lot of systemic establishment, infrastructure, training capability, and a product capability. We can see that the hospital has been, in the year 49, there's about 13,000. By now, is 878,000 hospitals. So this is a huge number. And also, medical universities, now it's about 100 medical universities, about 200,000 medical students graduate each year. And primary health system, this is a little bit unique for China. In a developing country with a very huge population, the system has been actually rather effective at a different level. Public health, we call EPS, epidemic prevention stations. Now they all changed their name to CDC at different levels, about 35,000 of them. And also we have the maternal child care hospital, which is also the same system, again about 35,000 of them. So they provide a lot of support to the, and also we have a third system is family planning. It's also, they are all in network. So this infrastructure, for example, the EPS or the CDC state system, they have staff about 300,000 all around the country. So we can reach any family, each house in the case of AIDS. So the low-level epidemiologists, they know in which family, how many people are there, how many of them got infected at which time. So they know all these stories. And also another thing, I'm going to use this slide twice. Actually, I will use the first part of this. This is the STD has been controlled in China for several decades at a very bottom level. Each year, just 2,000, below 2,000 cases STD in about 1/5 of the world population. So when I was in medical school 20 years ago, we didn't learn because there's no cases. My American colleagues told me that they were surprised that when China opened door in the early 80s, the Chinese scholar, they came to US hospital. The first thing they asked is to see STD cases because they have never seen in China. This is also through a partnership because overnight the country shut down all the brothels and provide free treatment to all prostitutes. More importantly, provide a job to all of them and also help them to build a family. Then STD is gone. This we can have several parameters which shows the social development. Infant mortality has been going down tremendously, and also the deaths as different age groups are going down, and also the maternity is also going down. But also you can see there's a big difference between urban and rural regions. So this is our challenge, our still existing problems. And for the infectious disease incidence and death has been dropped tremendously. We can see also from this chart. And as a result, the life expectancy has go from 35 years age to above 70, which is in the level of the developed country. I remember also that yesterday a speaker used a slide showing one country which are doing extremely well, Costa Rica, but China is just a few places below in that group. I remember the Dr. Thatcher, the former CDC director of US and Surgeon General. He came to our academy and gave a talk. And finally, he very proudly said the US government used 99 years to double the US people's life expectancy. Actually, China used half of the time. They also doubled, but much less money, much low technology. Mainly it's a partnership between government and the community. This is also the slide showing the life expectancy. It's still going up. Several diseases has been eradicated, and also China last year announced the eradication of polio, and the measles are very close. There are some other ones will coming followed. So this, but also there's in the last 20 years we see a lot of change, a lot of shift. Before everything is a government support, but now in the market economy you have to depend on yourself. So the worst hit structure is public health, because they don't generate money, they spend money. So that is a great challenge for this infrastructure. And also the GDP has been shifted from 100% state-owned to more than 50% private. And so that's direct funding to the research community has been dropped tremendously. And all national institute has to compete on peer review grant. So government only provide 20% of your salary, nothing more. So you have to compete for grants. And also since the Gold Institute, because the national grants are small, so they have to really survive depending on international fundings. And also here we see that still we see there's the government sector still have a lot of strength and a lot of infrastructure, even though they are also increasing the health expenditure. But you see from this chart, the government share is become small and small. For example, I use my lab as an example. So government support, as I said, 20% of salary. For all our students at different levels, 0%. And I get some money because in the national center we have a lot of technical support to the large 2,000 national laboratory networks. So we get 1 million from them for that activity. National grant, we have about 1.5 million. So one RMB, $1 is 8 RMB. Exchange rate like that. So the NIH grants, you see the international, I point here 2 sources. One NIH, so we get much more compared with the government support. And also we have several INCO grants to support our research activities. And the pharmaceutical industry and the state-owned also goes down steadily, especially in the last 5 years. We can see here, even 5 years ago, a little bit more than 5 years ago, the government-owned still in this area is about 50%. Now it's down to about 30%. The stock holding company and the foreign joint venture, they are added together is more than 60%. And also for many, before there are only 7 institutes that manufacture vaccines by biological products. There are many more, including many international big farmers like Merck, GlaxoSmithKline, PMC, and all these big players are in the Chinese market. And this is the health expenditure in the GDP percentage is still very low. It's by now even it's about a little bit over 5%. Many other countries like the US, it's close to 20%. So I think there are still space, there are still rooms to, to put more efforts to the health sector, including research. And there is a steadily increase, but just a little bit over the national GDP. The speed of the China economy did very well in the last 20 years. So average is about above 8%. Now this year is again 8%. So, but the ratio of this two is health expenditure a little bit over that. But I think it's not enough for this huge population. And another factor that we see that the national health expenditure is rather a small proportion of the whole overall health expenditure. So the government rule, again, shrink tremendously. So this all pose problems for the country used to be a planned economy, now become a market economy. The partnership between government and private sector is extremely important. Since yesterday, the chairman told me to give some data about AIDS in China, so I just go over that quickly. So this is actually AIDS came to China rather early, in the mid-80s. So we have go through an introducing phase, a regional epidemic in one tiny, small 80,000 population on the border with Burma, in the drug user population, about another 5 years, and then goes this rocket takeoff, which is mixed with IV drug use, the spread of drug users, and also unregulated plasma collection. So that is a pattern. The prevalence. This is the first province was hit here, and then spread to different parts. I have a picture later for our research with the molecular epidemiology showing that. So the prevalence is patterns like that. And the ID use for many years is a major drive for this epidemic. Still, accumulatively is close to 70% infection are ID use. But also we also see other factors are growing up. For example, the sexual transmission from less than 1% now is 7%. And also the blood collection I mentioned, accumulatively about 10% of the total infection reported. The characteristic of the epidemic in China is majority in rural area. Among IV drug users, is still a young male dominant epidemic. So there are also other factors which through our surveillance system, you can pick up the message that things are moving. We can see we have set up about 150 sentinel sites in different parts of the country among high risk and the general population. We test them twice a year, once in spring, another in autumn, to see the trend. So this is a trend among injecting drug users. So we see a very sharp increase in the last few years. And also religiously, the drug users, the total number are increasing. Now it's about 1 million a year. Of course, this is just registered. We estimate the active number is 5 to 10 times more than the registered numbers. And to a certain time, the commercial plasma donors got infected in China. This is one study which showed they can be close to 50% positive in one tiny village. And the history is that in the early 90s, the government in the market economy lost control. So from the many years, 7 institutes doing this business, and then when they lose control in a few years, there's about more than 100 small companies appeared, together with several hundred plasma collection stations to supply the raw material for those small companies. So they compete with the big government ones through low their price by reuse the syringe and all the equipment, so they infect a lot of people. So the first case of infection was picked up by our CDC in Hebei province. So they found it in 1995, and then they did a last study and found more in other provinces. Then overnight, all plasma collection stations in China are shut down. Many, especially in central China, are shut down permanently. The others are reopened only past government checkup. Then the government drafted a blood donation law and passed through parliament in 1 year. So the has been practiced several decades. Commercial blood donation stopped in China, become a voluntary donation now. And the HIV infection among this population, I mean the new infection, has dropped from during that period, 94, 95, 20% dropped down to far below 1%. But since the country is so big, we cannot say we completely sealed up. But still, you can scattered cases, but the major problem is not there. The major problem is that the people get infected at that time, after 7, 8 years, progress to disease. So in the last few years, these are first reported in the national medium in the headlines, then be heavily reported by the Western mediums. But we know that the other factors are driving this epidemic, including the STD. This part is takeoff. And also the sentinel in our sentinel system. And also you see among sex workers, the HIV prevalence is going up steadily, even though the absolute number is still low. This is also in the other part of the site, sentinel site. This is STD patients in the STD clinics. This is also goes up a little bit lower than prostitute, which is can be understood. There are other potentials for further spread of the AIDS in China, including we have the male homosexual population has not been well studied. In big cities, we already seen them have been infected, and also the virus are the North American, European strains. So they have a lot of activities among different country homosexual populations. And another thing is that because the Chinese culture are not so tolerated for homosexual, so many of them have a family. So they can, not only among themselves, can pass the virus in their families. Another factor is that we have over 100 million mobile population, which are most of those farmers left rural area, come to city for jobs. But they still have their family in rural region, so they go back at least once a year, sometimes twice a year, to help do the harvest. So it's not like a Western country. The people leave their home, they stay, maybe they don't go back very often. But in China, traveling a lot. During the Chinese New Year, there are about 300 million people using trains. So they are not in the infrastructure. So it is very vulnerable for this disease. So putting all these factors together, we had an estimation so we have about 21,000 cases. So what is the real cases of HIV and AIDS? So we have several systems. For a national reporting system, a surveillance system with 150 sites, and HIV screening service test done by blood bank, by military recruitment, and by many other biological products. They test about 30 million people every year. And also using the component model or DAFA model to estimate. This is our estimation. Currently, we have about 1 million infections. And based on that, we made a projection. By year 2010, the number could go to 10 million if we don't do anything. So whenever we talk about epidemic, we use the 3 numbers. This is what we call epidemiology data set. Reported cases, estimated cases, and projected cases for the future. I have not seen any country estimate that fold, 33-fold, multiply the reported cases. Normally, it's a 3 to 5-fold. So there's, because the country is huge, our testing resources are limited. So we rather provide a aggressive estimation than a too conservative one. This is the goal for our whole campaign. The projected cases is 330,000, 330. But we run into problems. This is, I don't know what's the reason for that. Many times, including last month, has been heavily reported by the Western medium. They separate our number, our data set, into 3 parts. They said, this one is government, this one is from honest scientists, the last one is from international agencies. Actually, this is all through our work. So we are very, very unpleasant if you read that, because this is all through your hard working in our group, in our structure. We feel that no reporter or no other group have resources as we have. The scientific methods is more or less universal. So we invite the best scientists from US CDC epidemiologists to help us do this estimation. But it's still like this. I mentioned a little bit about the governmental response for the epidemic. There also, the government initially didn't pay enough attention to it. This is a real problem. I remember when we first asked for a P3 lab, we have to lobby 3 years to get the money from up to our prime minister. But when the money arrived, but we already made the order through our European friends like Professor Hans Wolf. But the lab has been stopped by the, a committee called Paris, some committee to regulate high-tech export to the communist countries. The order has been held up for 2 years. The Chinese yuan goes down. When we get the lab finally, we have 1 million yuan in debt. But later, things are slowly getting better. This is a State Council Coordination Committee. Before 95, the whole national AIDS program is run by just the ministry. It's just a public health issue. But since 1996, the central government take the leadership. The organizers called State Council Coordination Committee is chaired by the Vice Premier, and a member are 34 ministers. These all government bodies are involved. So it's become a real national program. And so the target is to mobilize in the whole society to not deal with just a public health issue. And also they made 2 national plans. One is a mid and long term in 98, so 13-year plan. And then last year, another accelerated 5-year action plan. Those are the control measures. It goes from mobilizing education, behavior intervention to research. So it's a rather comprehensive one. I make a few points using one for education last year in the World AIDS Day. So we had the first National AIDS Conference, a big one. And the conference has been nationally wide broadcasted on TV, the Channel 1 in the golden time. So 130 million people watched. And a survey afterwards shows that from 13 provinces, about 6,000 people, 81% has been exposed to this message. 36.4% watched TV. In China, TV coverage is very high, including rural areas. We have been very admired Western, especially the US campaign, use a lot of film stars, but for us it's very difficult. But last year we are very successfully lobbied. So one of the most famous Chinese film actor become a national AIDS ambassador. And this poster has been shown about 50% people. This is for the everything. If without money, it's nothing. So we can see that before that, the national budget, the central government for AIDS control is very minimal. Before 95, its highest year is 5 million. And then in the mid and long-term plan stage, it goes 3 or 4 times up. But with the 5-year action plan is another boost. So 500 million has been put for 91. In addition, they put 1.25 billion to strengthening blood safety, and another 2.3 billion for infrastructure building. Another example showing the partnership between government and private sector. The government is drafting a national AIDS treatment and care program. This is also, I think, thanks for a Medium report, especially for the plasma donors. This pushes the government to do something. So now they are serious. So they negotiate with the big farmers to cut down the price, but they only agreed by half. So $10,000 is unreachable, $5,000 is the same. And they speed up a drug review and evaluation process. Before any drug imported to China has to go a phase 1 toxicity study. Now they change the rules. the drug has been used in Western country is effective to treat AIDS patients. They don't need to do that. They can go to the market directly. Lose control. And a tax-free deal has been made without tax for AIDS drugs. And also for the retail price, or the small company in between, they cannot get a profit from selling. So it's controlled. And another is a policy support for generic drug development related to the question the audience asked just a moment ago. And a free treatment for HIV-infected plasma donors is under planning. Government will provide free drugs, including assistance to their life, some like a minimum money for their life. And also a national program have money for VCT and for training for clinical personnel. And all laboratory systems are asked to do support for testing and monitoring drug resistance strains. And also the government is considering WTO articles such as compulsory licensing and general parallel importing. Last month I was in US when I arrived at the campus, and the colleagues in vaccine center said, "Oh, Dr. Shao, you are famous. You are quoted in the New York Times." What I said is government, because we know the drug has to have a combination use. So especially the proteinase inhibitor, their patents has many years to wait for expire. So I said we have to think about some other mechanisms. To wait is a dead end. And it's a broadcast in the national TV, and the pharmaceutical company get very nervous. They call ministry. They start a negotiation for low down the price again. And the private sector played also an important role as a partnership with the government. So they have speed up drug research and development, and they are asked to provide low or no price or non-profit price drugs to government-sponsored treatment programs. As a result, in the last 4 months, 4 drugs, generic version, developed in China, already in the market. I think by the end of the year, there should be more. These companies, they have been producing these very pure chemicals for decades. It has been purchased by the Brazilian government, by the Cipla in India, and even by the big pharmaceutical companies. They get from China in the 1,000 kilo as a unit price. They sell out as milligrams in the market. So we have this capability, but private itself cannot do. They need government support. So this is a good example of a partnership. I would mention that even the Cipla company, which has been selling very low price in the international market, played a major role to bring down the drug price in the international market. But inside India, patients has no access to drugs because the government didn't have programs to support. So drugs is only a small portion of the whole treatment care package. So they don't need a partnership. So finally, I just quickly go through these labs which we set up. And because the EMBL is a very famous research institution, I just, for my own purpose, go introduce some of the research very fast. So we're using this network, and we help them set up. We do quality control inspection every year, but we also use them for our research. So we do every other year a large-scale national molecular epidemiology survey. We sample the whole country. This year, we sampled another round, about 2,000 samples are collected for this year's study. So we have already found quite a number of HIV-1 subtypes, about 8 of them, in circulating in China. The major ones are the three ones, actually 2. This is subtype B. This is not the prototype in American European B. This is a B prime, type B. They introduced into China in the late 80s through drug users from Thailand, through Burma. And a second strain from India, we proved it's coming from India, arrived the same province about 5 years later. And then they got a recombinant, become a recombinant virus. We found 2 recombinant forms are circulating in the country. This too has been over 80% of the infected person we studied. So that is a major strength. We have some other ones like this, about 10% in our study population. Subtype E is many we saw in the sexually transmitted groups. And also some African strains are brought back by the rural area of China, central China, people working in Africa for constructions. So we have set up a large database with several thousand sequences. And also we can use the molecular clock, what we call in the WHO network, to study the population's wide HIV diversity. The more diverse, the longer the epidemic stays there. So with these 2 parameters, we can figure out how this epidemic are involved inside the country. And also from the similar study, we can see this province played a major role. This is heavily reported in the Western medium, Henan province. They though played a very bad role in the second wave of epidemic. So you see these arrows going out from that province. This is the 2 subtype recombinant forms. And this virus really, they travel along a drug trafficking route from Golden Triangle in this region into China along this drug trafficking route to the western part. So we have not yet have a collaboration with the Central Asia Republic. So I think they may go across the border. And also with Dr. Wolf in Germany, we have joint programs for vaccine development. So what we have focused is on these 2 types with European colleagues. One is viral-like particle, another is DNA. I will not go over. The third one is a Chinese, the vaccinia strain we used for smallpox eradication. So because my time is up, so we see that we have to do mapping in the population and HIV typing and to have a host of genetic background provided for the vaccine research. So we are going plan for a phase 1 trial in this province or here, but we are waiting for the release from the European Union for this lot. This is an overlapping project between China, Europe, called INCO project. It's already, we had the 3rd phase, we have a 3 grant overlapping. Now starting from the second INCO, overlapped with the EuroVac. But the European scientists seems they want to do, high-level study first in Europe. If that, maybe take another year. But the product is ready. We really want to open collaboration. We want to have that tried as soon as possible. This is the EIAV, as mentioned. I have no time to go through. This is the first lentivirus vaccine used in China, eradicated the epidemic, has been used 25 years very effectively. This is an old traditional vaccine through passage in animals and also in tissue culture. We thought that this is a good model to get some light for the current HIV study, because journalists is the book is shot in the dark. So we do want some light here from this model. So we have successfully cloned and also made an infectious clone. The infectious clone can protect the animal against lesser challenge. So the control animal died in 4 weeks, and the other animal stayed alive for more than a year. So we have tried to understand what is the lesser genes for this virus. When you convert the wild type into the vaccine strain, the animal gets sick and die. So we have figured out gradually narrow down. If we understand the mechanism of this virus, and we can convert it some knowledge into, this is we tried for the different genes, because we kept all the virus, several hundred passage virus in good condition. So we can go back to study the evolution, how this virus evolved. We pick up different mutations and different genes, and we go with biology, because they tested several thousand animals, horses. So we can compare what are the genetic part played a role in biology. So I have no time to go through, but initially we tried. Finally, I would acknowledge international collaboration with European Union. And also currently we had a CIPRA project from NIH. This is through many scientists are sitting here, like Dr. Ruth is our very important consultant for that program. This is multidisciplinary research. We can unite different teams in China. This project is 5 years, $50 million US. It's open, so we want to have more collaborations with scientists around the world. Thank you for your attention.
Thank you very much, and sorry for cutting you short. Sort of in the interest of lunch and the discussion this afternoon, we should only allow maybe 1 or 2 quick questions so that we don't run over too much. But for some short questions, we could take time.
Given the high level of subtype diversity you already see, and that you have a fairly widespread recombinant already, this would imply that there's a lot of exchange across risk groups, a lot of interaction between sort of classically separately defined risk groups. I wonder if you could talk about that, what you think is going on there.
I think when any place you see circulating more than one subtype, there is a possibility for recombination. It has been proved. And this is also the same in China. But as its impact on the vaccine development, I think I have two comments on that. One, we have to make something work first, no matter if it's only to the homologous strain or it has some spectrum of protection. So make one thing work first. With the modern technology, we are strong enough to make several vaccines to different subtypes. So we have to go one step by step. But in the case of China, you see there are large areas in the western part. Even though the whole country had 8 subtypes, but in that alone, that trafficking route, especially in that big province, they have only one subtype, only this recombinant one. This is we have followed them already 7 years. There's only one strain. This is very homogeneous. After 7 years, diversity, it should be already 5%, but there's only 2%. It's very homogeneous. So it's a very good place to start a vaccine trial, to get the complicated problem become simple.
A very quick question. In a country that's had a long history in which private information has been publicly managed for social purposes, what is the debate and what is the policy with respect to privacy of HIV status within the country?
Privacy, we have thought that very important from the very beginning. In '87, 2 years after the first case was found in China, at that time it's only about 25 cases found. The government passed a law, a regulation to protect the rights for the HIV and AIDS patients. But I should say that at the high level, that already been developed into a law, renewed 2 years ago. But at the high level, it has been, acknowledged and has been maintained well. But at low level, it's not that good. But I think we cannot, force people to do. That has to go through education of the whole generation, population.
But one last question there.
Yeah. Quick question. Could you please say some words about the vaccine? I mean, which principle you are using for this vaccine? How it works? I mean, just a few words.
Okay. Currently, together with Hans, we are working with the DNA prime and vaccine boost strategy. And also we have a collaboration with the NIH scientists in the vaccine center. So we found if you primed with the DNA, boosted not with 1 but 2 live vector, the result is better. You boost first with adenovirus and then with vaccine. That result is the best. But that is current. So this is what we call the first round of vaccine research. We have a second round. We always want to preserve something for if that first round doesn't work. So that is our EIV study, and to compare already successful antivirus vaccine mechanisms.
Okay, thanks very much. I think